Dr. Trubow, for joining us today. We are going to discuss on this session today her new book that her and Dr. Levitan wrote together. And the name of the book is Dirty Girl. It's an honor and privilege to have you on our programs. First, I want to wish everybody a happy and most importantly, a healthy new year. This virus will be over sooner or later, and we hope it's sooner than later. I wish you guys all to stay well. This is going to be an interactive Zoom session. Dr. Trubow is here to answer questions. She will discuss her book a little bit, and then we want to open it up to the audience with any questions you may have that Dr. Trubow can answer. Let me introduce Dr. Trubow, and then we can get going.
Thank you. It's so great to be here.
Thank you so much. It's I don't know how busy you are. Taking time from your busy schedule to be with us is a privilege and honor. Dr. Wendie Trubow is a doctor, is passionate about helping women optimize their health and lives as a functional medicine gynecologist. Through her struggles with mold and metal toxicity, celiac disease, and other health issues, Dr. Trubow has developed a deep sense of compassion and expertise for what her patients are facing. And it's an honor and privilege to introduce Dr. Trubow. I'll give you the microphone to discuss your book a bit, and then we could open it for question and answers. Thank you so much.
Great. Thank you. I'm in business with my husband, whose name is Dr. Levitan, and we've been wanting to contribute to like the world with a book for years. And every topic we came on was so boring, like so boring. Functional medicine, big picture, super boring. Our 5 Journeys Approach to Health, also really boring when you like write a book about it. And what happened was about 2.5 years ago, I started to have a number of what I'll call health setbacks. They weren't quite crises. Well, okay, a perimenopausal woman who gains 9 pounds, has a rash on her face and loses half her hair. For me, it was a crisis, but really when you put it in the scope of things, it was not a crisis. It was simply a setback. But I was perimenopausal and I did all this testing on myself and figured out that I had mycotoxins, heavy metals, specifically lead and mercury. I had a ton of the environmental toxins and it was making me super sick. And what I looked at my husband after I got one of these rounds of tests and I said to him, I am such a dirty girl. And then I said, now that's an interesting book to write. Let's write about my struggles with toxins and really let's back up a step. We've been in the functional medicine space I've been in it since 2009. So we're 13 years and I don't eat gluten and I don't eat cow's dairy and I don't eat sugar and I don't eat processed carbs. I don't drink alcohol. I'm like super boring. And yet, I, by the way, I exercise. I thought I was getting enough sleep. Like I do everything right. I try not to be a stress ball. I try not to hold on to grudges. And yet I have all these toxins. And so that really opened up this inquiry into, okay, how are they so common? If I have them, what does everyone else have? And since I've gone through the process of trying to get rid of them, let's make it easy on people. Let's make it attainable. Let's make it in a way that they can understand it. It's not medical speak. It's simply, let's open this up so everyone else can participate in it too, because, you know, all things setting the weight gain and the hair loss and the rash aside, all these things are also risk factors for different types of tumors and Alzheimer's and dementia. And those are things, I mean, I definitely didn't want to gain 9 pounds, but I really, really didn't want to be at risk for anything that was super nasty for your health. And that was the motivation for really getting into getting rid of it, essentially. So I've spent I'm coming up on 3 years actually. And so the preface is, it's not a quick fix. It's really a lifestyle process and a change. But I've spent the last 3 years getting these toxins out, rejiggering my life, redoing our food, redoing all the beauty products I use. And to stress, it's a process. It's not a sprint. It's not even a marathon. It's really like a process, because you'll figure out, oh, you leveled up, but maybe it wasn't the best. I do that a lot. So that's why we did the book.
I will be reading the book after Mrs. Gardner finishes the book. And I just want to introduce Beth Gardner, who's our health and wellness director for the 4 locations that we is under the Dino Health umbrella. Obviously, we have locations in Acton, Concord, Lexington, and Newton. And she's been a wonderful addition for the past several years, working with our patients and such, and with somebody like Dr. Trubow on supplements and wellness and health and just just what you shared, Dr. Trubow. So I just wanted to introduce Beth. So I'm going to open it up for questions and answers, Dr. Trubow. Is that okay?
Yeah, of course. And really, let's just say, like, this is a huge topic. You can ask me anything, and there's pretty much nothing off limits. So feel free to ask like what you really want to ask, and I'll answer it. Hopefully.
Yeah, I mean, we're gonna obviously focus on the book is obviously focused on a woman and such. So any joint pain, any lack of energy, weight gain, IBS, brain fog, all that stuff that Dr. Trubow has written in the book is open for discussion. So if she doesn't know how to answer something, she will tell you that. So feel free to ask questions. You could I could unmute you and you could do it that way. You could send it in the chat, whatever's easier for you guys. So I already have a question in the chat, I believe. I couldn't get in the meeting earlier. I have been booked solid. Oh, I'm sorry. Yes, so all set. We are ready for questions.
I can also keep talking, but I don't have anything prepared, so it's going to be way off the cuff.
So I have a question for one of our audience members. Curious how she figured out she had mold.
Such a great question. Okay, so I've always been someone I'm a sensitive soul, shall we say. So I had asthma before I got diagnosed with celiac, and I had chemical sensitivities, and my poor mother-in-law, she was like, I can't wear my favorite perfume. I'm like, no, I can't breathe. So I was always a sensitive human being and kind of highly reactive. And I lived in a number of apartments where I suspected I had mold, but I've always just been a very reactive human being in that sense. And the mold test, okay, let's just preface this by saying doctors are terrible patients. Okay. They're the worst. And we were starting our practice, and the rep said, are you going to offer this test? And I was like, I don't know. It was a mold test. I'm like, I don't know. I hadn't really thought about it. I'm a gynecologist. It's kind of outside my scope. Haven't done much of that. And she's like, why don't you do it on yourself? Famous last words. Why don't you do it on yourself? 7 words changed my life. So she said, do this testing on yourself. And I went, okay. And I did. And I came up with 4 strains positive. And it was actually a couple months before I found out about the metals, because I had started to explore toxins even before getting my lead exposure. And so I started working on that after I did the testing, which showed I had these strains. And I was like, geez, I'm like generous and a huge repository. I don't let go of stuff. Clearly, I'm not the best detoxer. But as I started to treat it, I got less reactive. And it was only in retrospect that I could see that. So it wasn't like on any given day I said, oh, my gut's so much less reactive, or now I can tolerate perfume. It wasn't like that. It was more where I said, hey, I just sort of look back and realized my typical gluten exposure would take me 6 to 12 weeks to get better from. And that one only took 2 weeks. And then it got down to like a week. And then it got down to 24 hours. And now I'm down to like 12, which is amazing, because it used to really it still throws me off, but it used to throw me off the cliff. And then I'd have to hike back up with no ropes. So it's been really meaningful to have that occur. So I figured it out because I did the testing. And I can't point to any specific mold exposure that I had where I went, oh yeah, that was clearly an exposure. But I know that I lived in homes and buildings that had, like, I lived in a basement. That's like the worst thing for me to do. It was an old Victorian house. So I'm pretty sure that had some mycotoxin strains in it. And then I also lived in another older home that had an unfinished basement. And so any place that I lived that had wet, I can look back and go, oh yeah, I'll bet that was an exposure, but I didn't recognize it at the time. So it was really by doing the testing that I figured it out.
Thank you so much. Daphne, did you have a question? I know you came on real quick. You could, this is an open mic as well. So if you're not shy enough, you could ask the question. So.
I'm actually typing it, but I'll stop typing and just talk. two of my daughters have stomach issues constantly.
Yeah.
My 16-year-old at 15 cut wheat out completely, and she's doing so much better. But do you discuss leaky gut in the book? Because I really need to learn more about it. We suspect there's more going on.
Say that I missed the last part of your question.
Yeah,
It was
my
very
dog
quiet.
barked.
Yeah, he barked over you. Those dogs.
I know. That's why I mute everything. So my youngest, I have 4 kids, but 2 have stomach issues and have had them for a while. I suspect leaky gut, and I'm wondering if you talk about that in your book. She cut out wheat and is doing a lot better, but she's not 100%.
Yeah, so this is a huge topic. I'm going to try to do justice in it, okay? And feel free to chime in if you like, oh, that wasn't really where I was going with that. So if you're someone who's sensitive to gluten, it's a genetic issue. So celiac disease, which I have, is the essentially where they've drawn a line in the sand and said, okay, if your antibodies are above this level and the villi in your gut are blunted, then you have an autoimmune disease. However, it's not like, for most people, it's not like you just flick a switch and you go, okay, yesterday I was totally fine with gluten and now I'm autoimmune. No, it's really, that's just the point at which you're diagnosed. But there's a whole continuum of illness that occurs before celiac. And I mean, our job is to hopefully prevent people from ever getting celiac, but you can be gluten sensitive long before you get the autoimmune diagnosis. And the reason that matters is that because it's genetic, if you carry one or both of the genes are DQ2 and DQ8. So you get them from your parents. They're not sex linked. They don't discriminate. They give to anyone. And if you have one or both of them, it increases your lifetime risk of getting that autoimmune disease, but you can be gluten sensitive. And what happens when you have this gene, if you have the gene in your gut, you have increased numbers of receptors for gluten. And when you eat gluten, it essentially, to bottom line it causes this event where you create your own leaky gut. So if you don't have the genes, whenever you eat gluten, you open these tight junctions in the gut for about 15 minutes. And create a scenario in which anything inside your gut lining can get through into your bloodstream. But after like 15 minutes, it closes. Someone who has the gene for celiac, when they eat gluten, you upregulate these receptors and it opens the lining. It upregulates zonulin, which causes the tight junctions to open, and it occurs for like 4 hours. So instead of having 15 minutes of exposure to the outside world in your bloodstream, you have 4 hours. Now you layer on, what's a typical teenager's diet? Cereal or bagel for breakfast, or toast. My kids love avocado toast. Okay, that's breakfast. What's lunch? A sandwich. What's dinner? Often pasta with chicken and a vegetable. So they've now, and if it's not gluten-free, then they've now spent, if they've had it 3 times during the day, and don't forget what's a snack, cracker and cheese, or some crackers. So if they've eaten gluten throughout the day, then every time they've opened their tight junctions, and that creates that, what you're talking about, that leaky gut, because the bloodstream, it's where particles, bacteria, food, heavy metals, toxins, whatever it is, gets through the lining of the gut into the bloodstream. The bloodstream goes crazy because it's recognizing all of these foreign entities and saying, okay, well, I need to mount an immune response against this, and this. That's why when you do food sensitivity testing for allergens, or allergen testing for foods via the blood has all of these reactive measures because it's been seeing all of these particles in the bloodstream and mounts an immune response. So when you track backward, taking out gluten is amazing. And she should be congratulated because she's a teenager, and teenagers go out and eat pizza. So good for her. Like, that's really good work. And then the next step is to heal the gut, because that sort of unrelenting exposure creates a state that's stressful for the gut, and then you have to recover. So there's and you can have other food sensitivities too that develop. So the most common ones are dairy, followed by, so gluten and dairy are sort of in pole position for the top, and then corn, soy, eggs, legumes, nuts, seeds, those are all kind of close behind that. And so what she probably wants to do is work, she can see our nutritionist who does functional medicine. She can just work on nutrition to see, are there other things to cut out that make a difference? Is she taking a probiotic? Because a state of inflammation can make the gut unhappy, and so you can have imbalance in the gut microbiome. So it's sort of this whole holistic approach. And if she's particularly stressed, that can also impact her ability to digest her food, so she can have malabsorption. So there's like a lot of levels to this. But I think, I mean, first off, she should be congratulated, because that's really hard work. You know? And it sounds like it was meaningful, and there's more to be had for improvement.
Just, I don't want to take, other people's time to ask questions, but can you test for those two genes?
Say that again? Oh, the two genes?
Yeah.
Yeah, so DQ2 and DQ8 are the two genes that put you at risk for celiac.
And you can test for that?
Yeah, you can test for that. You can either do 23andMe or Ancestry.com. You can do a test, what I'll call outside the system, on your own. So you can pay for it yourself and just do it. I like that approach because, I don't know, things change kind of rapidly in healthcare. And so anything that you can be discriminated against, I think it's better to have outside the system. So it's not just something someone has a knee-jerk response like, oh, you're predisposed to something, so we're going to discriminate. Just get that information outside the system. But you can also, I mean, I do a ton of testing for celiac in my practice, and that's part of it, is the genetics, to see if someone's even at risk for it. So it's very easy to test.
Last week with functional nutritionist. So we're headed in the right direction, but I just need to understand it all.
Yeah. So a functional nutritionist is someone who does functional food, functional medicine from a food standpoint. So it's not a traditional nutritionist who's necessarily looking at how many calories did you eat. They're looking at what are the foods that you ate that you didn't feel well when you eat. Let's create a plan that works for you, that eliminates those foods, and then challenge, if appropriate, to see how you feel when you do it.
What is your feeling about silver dental fillings?
Yeah, that was a blind spot for me. I knew that they were, I did not, they're about 50% mercury. And so for me, this is a blind spot, and I'm acknowledging it because it's so important in the process of detox and detoxing your life to recognize this is a process and you're going to screw it up. And this is an area that I screwed it up. So I'll just share with you, I have 3 amalgam fillings in my mouth, and I have basically been like, nope, not getting them out. How bad could they be? So this is where you go. Doctors are terrible patients, and every human has a blind spot. So I was like, I don't know. I don't want them drilling into my teeth, and it's hard enough, and I don't do well with dental stuff, blah, 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 all the noise, right? So all these human excuses. So I met with my husband's dentist, who's a biological dentist. She's awesome. Her name is Yuko Torigo. She's in Boston, in the South End. I'm like, could you be any harder to get to? But she's amazing. And I forget the name of her practice, but if you look up Yuko Torigo, you'll find her, a biologic dentist. So I had a consult with her because it's been a really long time since I cleaned my teeth. And she said to me, well, look, they're 50% mercury to start, and they off gas indefinitely. And I went, oh, well, that's probably the reason I'm having trouble getting rid of my mercury, because I'm still being exposed. And that's like the first tenet of detox: stop being exposed. So I share this with you. So to circle back to the question, what am I feeling on silver fillings, is if there's any way to safely get them out, I would recommend it, because when you eat, brush your teeth, drink something warm, you get another load of mercury and you get exposed again. And so it can be this ongoing thing that's hard to get rid of. So all in, if it's safe and you can, I would get them out. I'm getting mine out on February 4th. Mixed bag, right? I'm excited, but I'm also going to get an IV that day. There's no podcasting that day. It's just get my fillings out and go get IVs so that they can bind whatever came out from the release of the fillings, because that is an exposure. Really taking your fillings out is an exposure. So you want to be careful to take extra glutathione and maybe get an IV and take it easy that day and eat lots of cilantro if you like it. I hate it, but if you like it, go for it.
Do you do the IVs at your
Yeah.
Practice? Okay.
Yeah.
So the next question is, what company do you use for testing, and do you recommend the home testing?
Yeah, so we have a couple of favored companies. So we use Great Plains for the mycotoxins, the environmental toxins, and the pesticides. And the reason we do that, we also use real-time labs which is covered by Medicare. So it sort of splits into this decision tree. So if you have Medicare, you get real-time labs for the mycotoxins. If you paid for that up front, it's $7.99. So nobody wants to pay that. So we use the Great Plains labs for the people who either don't have Medicare or don't want to pay $7.99, which I don't blame them. So that also is one urine test that you do at home. Both of these are home tests. They're urine tests. You take glutathione for a week, do the test, send it in. And then for the heavy metals, we use doctor's data to test for the heavy metals. And we do a pre-test, which is just a baseline urine. And then we give you DMSA, which is a provoking agent. And then we measure your urine for 6 hours. So it's a timed provoked test. And then that you can also use Quicksilver, which we use for, which I never did. Another, there's my fillings are my blind spot. So Quicksilver offers a test called the TRI test. It's $285 and it looks at hair samples and blood samples and looks at whether the mercury in your system is meaningful from fillings or from other exposures. So it helps, it helps people winnow down whether the fillings are a problem for them. I would say if they're present, they are.
Do you feel the hair testing is accurate?
So they use hair along with blood. I'm not a huge fan of hair testing, and here's why. That requires that your body's actually moving the metals, and you often need to work much harder to get those metals to come out. And so that's just kind of what's your baseline ability to excrete, but it really doesn't tell you what's being stored in your bones and your organs and your fat. So it's not getting behind the veil, essentially.
So we have another question. What would you recommend for prevention for someone who feels well and wants to keep it that way?
I love that question. So I would say that question is about 3 to 5% of people who come to our practice say, I want to make sure I don't get any chronic diseases. That's the category. I feel good and keep me there. So this is where it's sort of nuanced. So it's an interplay between how much is it worth to you and how bad is it? So I'm a huge fan of data. I always say to my patients, I'm a data hog. I like to get the data. Let's check and see what the problem is actually. And if we get the data and there's no problem, then I go, okay, great. Check it every couple of years. The Great Plains testing, the whole thing is $537, and the heavy metals testing is $174. So it's not a cheap date. It's not like, oh, cool, I just found $750 lying around. It's an investment. And so I usually recommend doing it for a baseline and then addressing what you see. So if you feel good, then I would say metals are the most important thing to look at, because many of us were exposed either because of our age, because we grew up in the 70s, or because our parents gave birth to us who grew up in the 70s. And so I'm 51, anyone who's my age or older, I say, we all grew up in the Wild West and nothing was as regulated. So we got exposed to lead in the paint. We got exposed to mercury in our fillings. We ate lots of sushi when we discovered it in the 90s. We've been exposed in multiple ways and we tend to store that. So I would say heavy metals is the most impactful to look at if you feel well. That would be the thing I'd say, just make sure there's none of that. And then the next would be the environmental toxins. And what I mean by that are those are all the things that aren't the metals or the mycotoxins. So I had high levels of gasoline fumes. So of course I stopped pumping my gas. I was like, okay, well, I don't need to pump my own gas. Someone else can deal with that. So things like that, where you can start to minimize your exposure. I had high levels of the toxins contained in nail polish. So there went my beautiful nails. Okay, like we're taking away all these fun things, right? So no more sushi fish, no more beautiful nails, and certain beauty products are very high in phthalates and other endocrine disruptors. And so really looking at, are there exposures that are meaningful so that you can start to level up on what are your beauty products? What are you using on your skin? Because those are absorption points. So that's the environmental test. That's the other one, because you can stop exposing yourself if you know that there's levels that are high.
Your book talks about toxins and talks about things that, in the environment, what we eat, all of those things. So sometimes people, they get very fearful of all of that. So is there a cure, or can we only treat the symptoms?
So the symptoms are the flag waving, saying something's not right here. if you have symptoms that need to be directly treated, of course we treat them. So for example, if you have significant levels of metals and it's impacting your cardiac status and you have hypertension and you have high cholesterol and it's dangerous, then of course we're going to treat that while we try to pull off the underlying causes. But the symptoms are really the barometer saying the system's out of balance. So Beth, I want to make sure, did I understand the question? Am I answering that properly?
Well, a lot of times people will say, with a lot of diseases, there's no cure, there's only a treatment.
Yeah,
So
I reject that.
talk about toxins in our body, or we talk about, things, is there no cure? Is there, but just treatment?
Okay, so I 100% reject that philosophy that you're just meant to get all these diseases and take all these drugs. So I would say the majority, so there's a component of illnesses that are genetic and we can't do anything about. Now I'm like, well, what would that be? Like, I don't know, because I have celiac, it's a genetic disease. If I had been able to intervene ahead of time and even understand the process of the disease, I could have not gotten that disease. But so let's take any autoimmune disease, thyroid disorder, lupus, any autoimmune disease is something that is the system crying out for help and saying, I'm super inflamed, I'm overloaded. And then it might be toxins, or it might be the foundational things like the food you're eating is impacting you poorly. There's too many processed foods, or you're very sensitive to something, or you have major nutritional deficiencies and that's impairing how the system functions. So you have to really peel off what there is, but I thoroughly reject that your diabetes is just missing insulin. I thoroughly reject that, or metformin or some other drug. Absolutely. Because a lot of these illnesses do track back to either something systemically off or toxins, and it's fixable.
Thank you. I wanted to clarify that. Thank you very much.
Yeah, thank you.
There's part 2 of that filling question. If the fillings have been removed, are any leftovers remaining?
When you say, so the fillings have been removed, it's funny, just got my x-rays done at this at Yuko, and she said he left you a little souvenir underneath the white filling that he put in. I was like, oh, please don't tell me you're going to drill in and regret that. She goes, no, it's covered. There's no way for it to go anywhere. But so you can, if you're not looking in the right place, you can leave what I'll call souvenirs of metal. And then it sounds like the underlying part to that question is, once you've taken out the mercury, did it all leave you, or are you left with some mercury in your system? And that is sort of individually determined. So if you are someone like me, who's a terrible detoxer, and I have 2 genes for MTHFR, I have 1 for COMT, I have 2 genes for vitamin D deficiency, plus the celiac, kind of residual gut sensitivity, I'll call it. And so I don't react as well to challenges as people who I call them strong like a bull. They can like stay up all night. They can drink just ridiculous amounts of alcohol and be totally fine. Whereas I'm a quivering puddle. So constitutionally, if you're constitutionally strong and you're someone who's a good detoxer, because there are people out there who are good detoxers, I just happen not to be one of them. So if you're a good detoxer and you've gotten your metals out and your liver's doing fine, then you're going to potentially get rid of that mercury exposure. And then other people, if it's like, that's the straw that broke the camel's back, right? If that's the thing that tips you over, then you could get sick from having your mercury fillings taken out, which is why I would always say go for a biologic dentist, so that they're going to protect you as much as possible while you're taking that mercury out, because it is an exposure. And for some people, it'll be the thing that clicks them over into illness.
Someone's asking the question, COMT gene, what is that?
It's another one of those genes that makes you at risk for poor detox. It's a risk factor for certain estrogen dependent cancers, and it sometimes makes it hard to deal with activated B vitamins. And then the flip side of it is MTHFR, which I referenced also, is another gene that makes it hard to methylate your B vitamins. So the good news is that I seem to be more towards needing the methylation and not reacting to the methylated ones, but it's something methyltransferase. I can't remember what it's called, which is why we call it COMT, because it's too long. What I usually recommend people do is do the 23andMe. I did the 23andMe, so I usually recommend it because I like the interpretation. And there are interpretive services that you can pay for like $10 and essentially connect the 23andMe with the interpretive service, and it'll take your raw data, which is super overwhelming and unusable, and convert it into, okay, here's your methylation profile, here's your detox profile. So we did that with us and our kids, and we've kind of, my oldest daughter is a terrible detoxer. Like on paper, you look at her and she's like, all the genes that you could be off, she's off. And then one of my other kids is like a normal detoxer, and they had surgery on the same day. We didn't get a discount, but they both had their their adenoids out on the same day. And the one who had the terrible detox, 3 weeks later, she's just sort of coming up for air, like, okay, I feel human. And like 2 days afterwards, the one who had normal detox was like, oh, that wasn't bad. And so just those kind of things are the ways that you can see the detox impacting you on a day-to-day basis. But I do recommend doing the 23andMe. It used to be Genetic Genie that you could use to do the interpretive service. I'm not sure if they still use that though. I'm not sure if it's still up and running, but if you type in, how do I get my DNA results interpreted, it'll come up.
Someone saying, I've done 23andMe, but where would I find that third party to coordinate the data?
Try Genetic Genie, and there's another one called Prometheus. So try both of those. I mean, it's been a couple years since I used them, so I'm not sure if they're still doing that, but those are two I would try.
So there's somebody who's asking something back to the mold question. Who do you use for mold testing? What are the costs? Thoughts on testing for mold in the home?
What was the middle? What was the what plus testing?
What are the costs of the testing?
Like benefits of testing?
No, the cost.
Oh, costs. So for home testing, it depends how suspicious you are, right? So if you see mold growing on the walls, then you don't really need to do a test. You have mold. And then I would test yourself to see what's relevant and staying in your body. But if you're not sure, if you think you have mold in the home, or if you think you might have had a mold exposure in the home and that there's water, you can start really small. Home Depot has mold testing kits. This is pre-COVID, they were $10. So they might be like $12.50 now, but they're not crazy expensive. And they recommend that you do a couple of samples around the home so they can get a baseline. So they're these little, it literally says mold testing kit. So I would do that if you're on the fence about whether what's going on right now is actually current, or whether it's some residual from an old exposure. And that'll give you, if you have a 6-room house, you can put one in every room and see, okay, what's going on in here? And then if you say, okay, that was inconclusive, but I'm pretty sure that my house is moldy, you can have companies come in. The company that I really like is called Indoor Doctor. It's a New Hampshire company. His name is Jeff Bradley. He's absolutely lovely, and he doesn't do the remediation. So what I like is he has zero conflict of interest, because he has no skin in the game about what you do after with the information. So I really like him, and it's called Indoor Doctor. Jeffrey Bradley is his name, and he runs somewhere between $700 and $850, depending on what he does and whether his prices have gone up from COVID. So it's not a cheap date, which is why I always circle back to, well, start with the mold testing kits, because they're really cheap. And depending on how big your place is, you can target, if you have a water stain, you can target that room and see, is it relevant? Is it growing in that room? And there are companies that go up to thousands of dollars. I don't know the names of them, but I would generally steer clear of companies that are going to test and remediate in the same, because I think that's a conflict of interest. So I would try to separate them. And if you can't, you can't, depending on your region.
So now we're getting on to a thyroid question. Do you think hypothyroidism is a result of heavy metal?
It can be. It can also, so hypothyroidism has a gajillion and one causes. So autoimmune, so Hashimoto's is related to toxins. Straight up hypothyroidism can be related to toxins, but it's less about the metals and more about some of the other toxins. For example, flame retardants are very toxic for the thyroid. And so if you have a thyroid issue and you're sleeping on a regular bed and it's not an organic mattress, then there's a good possibility there's a flame retardant in that. And most of us spend 8 hours a day in that. And so you're getting constantly exposed. And so the caveat here is if you just bought a mattress, get a high-grade HEPA quality filter, high-grade HEPA filter and run it in your bedroom. Don't buy a new mattress if you just bought a mattress unless you're really sick. It wouldn't be justified if you just bought a mattress, but there are a lot of things that can impact the thyroid's health. A lot of beauty products end up being endocrine disruptors, and the thyroid is part of the endocrine system. So if it's disrupting that, it can disrupt the thyroid. And then one other major thing is adrenal stress, because the adrenals are more powerful than the thyroid. So if the adrenals are out of whack, being overly challenged or asked of, and you have a sort of innate tendency towards hypothyroidism, the thyroid's going to show the effect of the stress from the adrenals, because the adrenals will impair the function of the thyroid.
Somebody said indoor doctor from New Hampshire for household molding. Can we put that on our site next to this so that we can get some information?
And that was Beth, that was me just putting it to the audience.
Oh, okay.
Okay. Thoughts on infrared sauna for detox, recommendations on temperature, time, etc.
Yeah, I love, love, love infrared sauna. Actually, we didn't take a vacation. So we took that money that we were going to spend and we put it into a sauna instead. And so we bought a Sunlighten near mid-far infrared sauna. And it's now become sort of the household joke. Like I have a date with sauna at night. And, my husband's like, everyone's like, where's mama? I'm like, in the sauna. So they have a setting for detox and it's like 134 degrees. And here's where doctors are bad patients. I'm like, I think 20 to 30 minutes a day is probably a reasonable amount of time. Okay. And around 135 degrees, as long as it's a near mid-far infrared, so you're really getting all the levels of cellular detox. I will admit that I go in for an hour and I try to get it up to 150. And this is where, I'm hardcore. I'm like, if I'm going to do it, I might as well let's do this. I've been in the sauna almost every night since December of 2020. And so it's 14 months that I'm completing and it's really great. And, I just want the toxins to go away at some point. So I tend to push it harder than I recommend other people pushing it. So 20 to 30 minutes, but if you're naive to the sauna, especially if you're at all struggling or challenged around health, don't start at 140 degrees for a half hour. Start at 100 degrees, 105 degrees, work your way up, see how you feel for the next few days, because it does release toxins. And so you might feel stressed or challenged, and make sure you shower afterwards if you sweat, because those toxins come through your skin. And if you leave them on your skin, you're going to reabsorb them. So get rid of them.
I had a metal plate and screws put in my leg due to injury. Unfortunately, they cannot come out. I do find my joints and sore. Any ideas?
I've got tons of ideas. I would say that definitely deserves a full evaluation to see what's going on. Usually the plates don't have mercury, thankfully. They can have other metals that you can react to. So, or what often happens is when you have that kind of event, it's really stressful on your body. And so the things that you were just kind of getting by with, that serves as what I'll call an inciting event. And you sort of it's another straw that broke the camel's back. You were okay, you were getting by. And then you had this thing where you had to have a plate in for an injury, which is traumatic. And then the surgery itself is traumatic. And then you have to recover. So there's a lot of layers to that. So my idea would be, I think you need a functional medicine evaluation to look at how are your adrenals? Do you have food sensitivities? Do you have any toxins that are being pertinent to this? Are you sleeping? For women, especially, perimenopause is cruel and unusual. That's our next book. We're going to write about how not to be a raving lunatic in menopause. And it's based, all of this is based on stuff that happens to us, because my husband my husband talked to me one day while I was having a hot flash and had to ask me something inane. And I was like, dude, do you value your life? Like, I'm having a hot flash here and I'm dripping sweat and you have to know like what color, blah, blah, blah. And I was like, don't talk to me. So anyway, back to the question about what to do, I would say, I think you need a full evaluation because there's so many variables that can be coming into why you don't feel well. So you really need to uncover that.
I see a question a little bit above. Someone was trying to get the clarification, basically, what is heavy metals?
Great question. Okay, so heavy metals, the ones we really focus on are lead, mercury, and cadmium. They're essentially, think of them like a mineral that your body can't move. They're heavy, so they sit, and they don't go anywhere. They don't decompose. They just sit. So, for example, nuclear is another example. Those aren't metals, but nuclear items just sit around and they don't decompose. So heavy metals are the ones that don't decompose and they cause an inflammatory state for us. And then whatever your particular Achilles heel is what way you're going to manifest your symptoms. So for me, it's gut. And for other people, it could be headaches or hypertension or thyroid or autoimmune, you name it. And I would say, yeah, you could manifest that way. I see Daphne saying you need the book for crazy lunatic prenatal, right? That's why we're writing that book. Like I can't tell the title yet because it's not released. We're going to start it in like June. It'll be out in 2023. But it's something about like sweaty and crazy, you know, it's like how not to be sweaty and crazy.
That's fun. If you think you may have adrenal fatigue, what tests are recommended? Should someone with adrenal issues avoid the sauna?
I like these questions. So anyone who thinks they may have an adrenal issue should be in the functional medicine space, not the traditional medicine space. It's funny, my neighbor is an endocrinologist, and I was like, oh, yeah, I see a lot of patients who have what I'll call adrenal fatigue. She goes, there's no adrenal fatigue. I'm like, right, you and I are not going to have a discussion. Because I don't think you can open a closed mind. And so if you're in the traditional medicine space, they may not actually have that as part of their vocabulary. So you probably belong in the functional medicine world, and you need, typically how we do it is we do both blood work to look at the precursors for cortisol, and we look at saliva cortisol. And the reason we don't do blood work for cortisol, which is your adrenal hormone, or one of them, is because the minute you come at someone with a needle, their cortisol goes up anyway. So you do the spit kit in the comfort of your own home. And that's my favorite, one of my favorite kits, because it's $80. That's like cheap as functional medicine stuff goes. So you need a functional medicine provider, do the testing, but you get a whole evaluation because you need to understand your sleep, your stress, your food, your adrenals, the rest of your endocrine system. And then the next level to that would be, are there toxins at play here that are stressing the system? There's a lot of evaluation that goes into that. I pulled up the comments so I can kind of see this. What was the brand and who installed my sauna? Okay. So the brand is Levitan, and it's considered best in class. Having said that, COVID was really hard on them in terms of customer service, and their customer service took a hit. So I do recommend them because the product is amazing, and it's not like Amazon where there's instantaneous customer service. They close on weekends. So having said that, who installed it was this guy who was doing some work for my husband's family for many years. He installed it. It's actually, if you can lift the pieces, it's not that hard because their design is beautiful. It's magnetic. So as long as you have the right pieces, they just stick together. You don't have, there's no construction per se. So that was really well done.
There was a question ahead of that, Bethan, right? Which said, I have done 23andMe, but where would I find a third party to coordinate the data?
Yeah, so I would recommend trying either Genetic Genie or Prometheus. Those are two brands that I've used in the past, two companies I've used in the past, but I don't know if they're still doing it. And so what I would recommend is then just doing a Google search, a highly refined Google search of, you put the word in and put the plus sign in between each word. So it filters out exactly that. So I would do a search with the plus sign in between words to limit it to 23andMe interpretation support.
Thank you. There's another question is, I don't seem to notice any difficulties with my immune system and sensitivity except to sleep. I don't want to take sleeping medications. Could this be a sign of toxins or of some other, I think it meant of toxins or some other sensitivities? And
Yep.
postmenopausal woman and really would like to sleep at night.
Yeah, honestly, I didn't sleep in my first pregnancy. I was out of my mind. So I feel your pain. So yes, it absolutely can be a sign of toxins or some other sensitivity or imbalance. The other option for postmenopausal women is that if your hormones are really out of balance, especially progesterone, that can make you not sleep. That would require someone to test it, prescribe it, and then monitor it to make sure it's not too high. And then Medicare does cover Medicare covers doctors who take insurance. Our practice takes insurance, certain types of insurance, depending on the Medicare plan. And so Medicare does cover a lot of the testing, which is pretty cool. Like it covers the mycotoxins testing, it covers the saliva testing, it covers the blood work, it covers a lot of the gut testing. So it covers a lot of it. There are absolutely things that are out of pocket, but especially with Medicare, it's less than with straight insurance. Medicare covers even better. Let's see. We do take new patients. My clinical practice is limited because we wrote this book and now I'm on a podcast tour. So I added in like a whole extra day of work and my kids said they want me home for dinner. So my practice is open, but very limited. And then I have two other partners, my husband, and then we have another provider who I see personally for when I can no longer treat myself, I see her, and her name is Dr. Marianella Levena. She's lovely. And we do telehealth. Yeah, it's almost all telehealth, especially with this ridiculous COVID surge that's been going on. We encourage telehealth because we are a vector and we prefer not to be exposing people if possible. So the question is, can medications for high blood pressure add toxins to the body? They can, but I think the question is what's causing the high blood pressure in the first place? Is that an issue of toxins? I think that's a bigger question than what the toxins, the medicines are adding. I mean, all these medicines typically, unless they're compounded, they do have some fillers in them. Sometimes they have colors in them. All in, you think about what's the greater risk. And if your blood pressure is really high, you probably want to take your medicine because you don't want to have a heart attack or a stroke. And so the toxins that are getting added, relatively speaking, is less concerning than making sure the blood pressure is safe. So safety outweighs what are you being exposed to. All right, what would your take be on a 21-year-old boy who's been taking melatonin for 11 years and can't sleep without it? Cortisol, saliva, 11 p.m. was normal. Great question. So melatonin comes from serotonin. And so I'd want to look at the gut and understand what's happening in his gut to see, is the gut bacteria balanced? Does he have food for the good bacteria that make the serotonin? Is all of that balanced out? And some people just need melatonin. It's not addictive, which is nice. And it's not going to shut the system down because it's an end point in the, how do I language that? It's not like TSH from the thyroid, which if you take too much thyroid, you're going to shut the system down. Melatonin won't shut the system down. It's augmenting what you need. And so I would look at the gut. I would also do a relatively frequent check on other things like, is he deficient in other things? Does he have food sensitivities? What's going on in there? Is he stressed? Does he meditate? Is he anxious? Because all those things are going to impact sleep too.
Dr. Trubow, speaking of melatonin, why does it work for some people and it doesn't work or it works for a little period of time and then stops working?
I don't know. I have no idea.
Yeah, we can't figure it out either. So I mean, it's a tough situation because people sometimes take 10, 15 milligrams, and I'm not sure that's recommended. But we notice that with a lot of our patients. So I just figured maybe I asked you just to see.
Yeah, I don't know. That's kind of like those questions I used to get, like, Dr. Trubow, when am I going to go into labor? And I'd be like, dude, when I figure that out, I'm going to be super rich. That's that kind of question. If I figure that out, I will let you know. And then I think Corinne had a follow-up question. Should we be concerned about fillers in thyroid meds? They're so tiny. I know they're tiny and they're hard to split too. So Generally, no. As long as if you're, for me, I'm sure the pharmacists love me when I have a script, I'm calling them. I'm like, did you do the research on whether it's made on shared equipment? Because I'll be sick. I drive them nuts. But typically, if you're not someone who's anaphylactic or celiac, you probably don't need to worry about that. It's not a huge deal. It's especially if you feel reasonably well on the medicine. I think the bigger issue is some people don't do well with the generic forms of thyroid drugs. And so you often want to look to see how's the function of your thyroid on brand name versus on generic. That's the thing to pay attention to. Most people do okay with the fillers. And for every rule, there's an exception. I have a patient in my practice who cannot tolerate the fillers. And so we compound it for her, but she pays out of pocket because the compounding meds aren't covered. So if you're doing well on it, I don't think it's worth spending the money, because you can always, especially if you have a 21-year-old, you can think of better uses for that money. So don't spend your money on compounding. Natural dye, yeah, I do like the desiccated thyroid for some patients. Some patients don't do well on it, and some patients do really well. So that's where it's, no worry about the spelling, Corinne. So that's where it's really individualized. You have to drill into how do you do with it versus how should you do. Let's go based on what's real for you.
If you had to pick 2 or 3 tests, what would you do to start the process?
Only 2 or 3?
Top.
Okay, so I love testing the adrenals because that gives people information about their mood and their sleep. I love testing the gut because that gives them information about how their body works. And I love testing toxins because that gives them insight and power over how do they fix their future. So thank you all for coming. I have to jump off. I'm so grateful you all came. You're so patient. These are great questions. And we're at 5journeys.com. If you have other questions, feel free to reach out.
Thank you so much, Dr. Trubow. We appreciate you. This will be on our YouTube channel, so you go back and review what this presentation was all about. We appreciate you greatly.
Great.
Thank you for your time. And thank you all for joining us. Stay safe, please.
Great to be here. Stay well.
Thank you.
Thank you, Dr. Trubow.
Thank you so much.
Bye-bye.
Thank you.